lessons, starting with dentin hypersensitivity. Dentin hypersensitivity is frequently the first symptom the patient reports within the context of non-carious diseases. It is the earliest warning sign that something is wrong, and because of that, it must be taken very seriously, not treated as a trivial complaint solved with desensitizing toothpaste. From a biological perspective, dentin hypersensitivity is related to Brenstrom's hydrodynamic theory, which remains the most accepted scientific model to this day. This theory describes that when dentinal tubules are exposed and permeable, external stimuli, cold, heat, touch, pressure, acid, generate fluid movement inside these tubules. This fluid movement activates mechanoreceptors in the pulpal nerve fibers, generating the pain response. The more exposed and open the tubules are, the greater the permeability, the greater the fluid movement, and the greater the sensitivity. An important point that is frequently misunderstood: dentin hypersensitivity does not necessarily require macroscopically exposed dentin. It may be present even when enamel appears intact, when this enamel is weakened, microcracked, with its structure compromised enough to alter dentinal fluid behavior. But here comes a concept that is fundamental for your clinical interpretation. The presence or absence of hypersensitivity depends heavily on the predominant wear mechanism. Not every patient with active non-carious disease will complain about sensitivity, and that does not mean everything is fine. I will give you a clear example. In bruxism, especially tooth clenching, the aggression over the tooth is low in intensity, but long in duration and high in frequency. This chronic and repetitive loading pattern activates a biological pulpal response, the deposition of tertiary dentin, also called reactionary dentin, inside the dentinal tubules and along the walls of the pulp chamber. This tertiary dentin progressively obliterates the tubules, reduces dentinal permeability, and with that, reduces or even eliminates sensitivity. This means that a patient with severe bruxism and severe wear may arrive at your office without any complaint of hypersensitivity and be interpreted as a patient without active disease. This is a real clinical trap, and understanding this mechanism protects you from it. The second clinical sign is cracks. A dental crack is the partial rupture of tooth structure, one that has not yet completed fragment separation, but already represents irreversible.